The Al-Andalus project started in 2007 and is conducted by a multidisciplinary research team composed by sports scientists, rheumatologists, psychologists, and biologists, among others, and it is coordinated by the Faculty of Sport Sciences at the University of Granada. The objectives of the Al-Andalus project are, first, to analyze cross-sectionally and to track longitudinally the levels of physical activity, functional capacity, pain, and quality of life in a representative sample of women with fibromyalgia from Andalusia, southern Spain, to determine the effect of two types of physical exercise, water versus land-based exercise, on pain and quality of life. Therefore, the design of the Al-Andalus project is composed by three studies: a cross-sectional, a 2-year follow-up, and a randomized control trial. The main results of the Al-Andalus project are: first, higher physical activity and functional capacity are cross-sectionally associated with lower pain and higher quality of life. Database of the 2-year follow-up study will be available in September 2017. And second, although preliminary analysis indicate that both water and land-based exercise promote similar improvement on fibromyalgia symptoms, people with fibromyalgia do prefer to do exercise in a warm swimming pool. The Al-Andalus project has been funded until 2019 with 3 new purposes: to carry out a 5-year follow-up study, to run other LCT studies to compare the effectiveness of hydrotherapy per se or in combination with doing physical exercise in hot water, and to analyze the genotype of our participants by a candidate gene study, including 64 single nucleotide polymorphism. The main partners of the Al-Andalus project are Southern Spanish universities, universities of Granada, Cádiz, Almería, Jaén, Huelva, and Pablo Lavide from Seville, as well as the Andalusian Federation of People with Fibromyalgia, namely Alba Andalucía. Additionally, we have collaborated with different research centers worldwide, most of them in Europe. Indeed, we are very open to establish new collaborations in order to improve the understanding of fibromyalgia and to disseminate our findings. Further information is available on our webpage and also by email. Thank you very much.
Our good clinical practice is entitled Non-Pharmacological Treatment of Chronic Pain, a Multimodal Approach. Our approach combines highly technological rehabilitation tools using virtual reality with neuropsychological support of the patient. Indeed, very often, with the chronicity of pain, patients undergo a distortion of the sensation of their own body. This perception of their own self leads to an incorrect pain rating, leading to an incorrect treatment of pain. Using our approach, we place the patient in the core of a multidisciplinary team composed of neurologists, neuropsychologists, neurosurgeons, neurophysiologists, and physiotherapists, all working in close interactions to provide patients with a personalized rehabilitative strategy. The treatment lasts 12 weeks. The patient undergoes 2 rehabilitative sessions per week, each one lasting 1 hour. We evaluate the effect of our treatment on the pain sensation of the patient. We also use functional scales as well as an evaluation of their quality of life. We have been treating essentially patients presenting with chronic low back pain as well as fascial pain. So far, 4 patients finished the treatment. 2 suffered from chronic fascial pain and 2 suffered from chronic low back pain. All of these patients greatly improved in pain rating scales, as well as in their quality of life, and as well as in functional scales. Another group of 4 patients are currently undergoing the treatment. This protocol involves the Hospital of San Raffaele as well as the University of San Raffaele, as well as the ARSOP, which is a scientific society organized networks of rehabilitation units of private Italian hospitals. Locally, the medical doctors involved are Dr. Iannacone, Dr. Federica Alemano, Professor Martini, Dr. Mandelli. The physiotherapists are Matteo Laccatelli and Daniele Emedoli. In the future perspective, we are creating right now a national network involving many major hospitals in Italy in order to communicate on this kind of protocols and create a national network of rehabilitation.
The objective of our project is to give trainee health professionals, that is nurses and doctors, the opportunity to hear firsthand, as part of the talk curriculum, about the personal experience of those with long-term pain in their encounters with health professionals. The sessions are delivered by patients who are also experienced teachers, and this method gives students the opportunity to ask questions and to delve deeper and to clarify the whole picture from the patient perspective. The qualitative feedback is reviewed by the universities, the School of Healthcare and the Director of Education, and it's been so well received that this has continued now for many years. In addition, the Pelvic Pain Support Network, patient teachers, have evaluated the feedback from the students, who highly value this input and say that it's inspiring, it brings everything into context, and it's very powerful and memorable. Students tell us they have no input or anywhere else in the curriculum on the patient experience of chronic pain or chronic pelvic pain, and it raises their awareness of the issues of management. They report that it will benefit them in their future roles hugely. So following this success with the undergraduate nurses, we began delivering sessions for fourth year trainee doctors last year, and these groups have responded very positively as well, with comments such as, why isn't there a multidisciplinary approach to chronic pain, as there is for cancer and other conditions? It highlights some key pitfalls for a future doctor to avoid, and it's so important to have the patient perspective alongside the medical model. The partners are the Pelvic Pain Support Network charity run by volunteers, the University of Leeds and the University of Southampton. Contribute to the pain content in the new undergraduate curriculum for nurses, and evaluate the feedback from the trainee doctors with a view to delivering future sessions for them and also in other establishments.
The aim of the study was to involve clustered HS patients into the education of the physician engaged in the treatment of these extremely painful disorders, with the purpose to improve their ability to manage this condition, and with the purpose to move from an ineffective symptom-based approach that is a paradigm dominant in the assistance of clustered HS patients to a patient-centered approach. This was realized by asking to expert patients from 5 different patient associations collaborating with the European Intellectual Alliance to give recommendation to the physician to improve their way of assisting clustered HS patients. At the end of the study period, we have collected 85 recommendations from 25 clustered HS expert patients from different 5 European countries. Spain, UK, Italy, the Netherlands, and Sweden. At the end of a qualitative content analysis, we realized that 80% of these recommendations could be grouped in 7 main recommendations that we are referred as the 7 commandments. The main challenge for the next future is to translate these 7 commandments that we consider as a sort of guide document of our activity into real improvements in the medical assistance for cluster age patients. So we'll start a series of action. First of all is an educational project entitled Patients Educated Physician, what the physician should know about patient-centered care of cluster age patients. And we hope to start in the next autumn with this activity in 4 different European countries. After the celebration of the Cluster Age Day that we held in Brussels last month, we have created a partnership with all the relevant stakeholders, members of European parliaments, civic organizations, patients associations, and the desk specialists to create different working groups to find a pragmatic solution to the problems that we gave evidence with this project. We have created a partnership with the day specialists to guarantee a fast access of this kind of patient to headache specialists. We are studying a way to score to give a ranking to the headache specialists to identify easily those cluster age friendly headache clinics. So we have many projects, and we hope that in the next future to realize something that really improve the life of these patients.